to approve the minutes of our last meeting. Supervisor Fraser, second by Supervisor Shepler. All those in favor?
Aye.
D, go to it.
First item, well, actually, the first three items kind of go together. We had a retirement at our Indian Lake meal site. The manager retired in December. After discussion with the Hamilton County Board and looking at the NYSERDA staffing requirements, we would like to fill the manager position at the current hours, but reduce the cook position to 25 hours and then fill that position.
Wonderful. Can I get a motion to that effect? Supervisor Conover, second by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Number 2.
Well, didn't we just put 1 and 2 together?
Andrea, we did.
1, 2, and 3.
Yeah, we put them all together.
So we've done 1, 2, and 3.
2 and 3.
Fantastic. So we are...
Moving along.
I want to tell you what to do, Mr. Chair.
Are we done? Can we go home?
We got one more.
Go ahead, Dee.
The last item is permission to reimburse heaters for the electrical work that they did for the meal transporters for the amount of $1,869.54. This is what we discussed at the November meeting. The county attorney did look into it, and she said it could go either way, whether we pay for it or they pay for it. So the county administrator suggested that we just pay for it and get it done.
Okay, can get a motion to that effect. Supervisor Conover, second by Supervisor McGowan. Any discussion? All those, go ahead.
This was,
Supervisor McGowan.
a lot of this was electrical for our new heating coolers, correct?
Correct, yes.
All right.
Yep. Now they're all in a central spot. They don't have to worry about fire safety hazards.
Yep. Yeah,
Great.
that was through Dean Electric, wasn't
Correct.
it? Okay.
Mhm.
Great. Motion on the floor and a second. All those in favor?
Aye.
All right.
Any opposed? No opposed.
That's it.
Okay, thank you, Dee. Appreciate your being so,
Well, that was
so
more
succinct.
to it today.
I tried.
You go, girl. Thanks so much.
Mental health. Rob. I got one, okay, so we're just move it over here.
Thank you.
You see the temperatures that they get this week?
Mental health, yeah.
Okay.
Thank
They
you.
get the street sweepers. They might even
That
go
could
out
be
for a
quiet.
motorcycle ride.
Let's see.
A little bit, yeah.
All that dirt and salt on my bike.
No, why don't we take your suggestion and, we even do something, don't you? Just keep, well, you would do something, to kind of,
No.
take a little bit of time. Yeah. Rob is going to abbreviate, a portion of, his, discussion, and, so we'll put it in the hands of Rob to, figure it out.
All right.
So, I have an overview presentation that I was planning on doing. I know that there's some new supervisors that are new to this committee, I guess. So I'm Rob York. I'm the Director of Community Services for Warren and Washington counties. I've been the Director of Community Services since 2002, and I've been with the Office of Community Services since 1999. So I was offering, what I could do is my other business today and defer the presentation to help the committee catch up time here, or I can go ahead and run through it. So the preference of the
What-
committee, I guess.
What does the committee wish to do?
Many of you have heard it before.
So, I think,
It would take me about 15 minutes to run through the presentation.
okay, but,
You know, a refresher's always good. and-
okay, why don't you just, run through it quickly, yeah? Yep, thank you, Rob.
I may need some assistance in terms of how I edit the slides.
Try to turn it on. Slides up there.
Yeah.
Okay.
It doesn't even have to use the keyboard. Use the arrows on the keyboard and that will.
It's wireless.
Yeah.
Okay.
That's it, Ken?
Okay, so I thought it would be good to just give a brief overview of the office. I'm Rob York, I'm the Director of Community Services. I'm a social worker by training, have my master's in social work and also public administration. We're a fairly small office, 6 office specialists, Crystal Lawrence, our Deputy Director of Clinic, Deputy Director of Fiscal, Harry Carlson, Program Analyst, Carrie Wright, Children's Single Point of Access Coordinator. This is for referral process for IEPs, children, and families. We primarily work with 3 state agencies, the New York State Office of Mental Health, the Office of Alcohol and Substance Abuse Services, and the New York State Office for People with Mental Disabilities. Actually, I have to update this slide. The OASIS recently changed their name. They are now the Office of Addiction Services and Supports. So it's still the same acronym, but they changed it. Okay, most of what we do is dictated by New York State mental hygiene law, and Article 41 directs local governments or counties to either provide or arrange for preventive, rehabilitative, and treatment services for mentally ill, developmentally disabled, suffering from substance abuse. In our counties, we don't directly provide the services, we do arrange for the service contracts, and I'll be talking about that in a minute. Article 41 of the Mental Hygiene Law also requires the establishment by the county of a local governmental unit, given authority in accordance with Article 41 to either provide or arrange for those local services. Office of Community Services is that local governmental unit, and we're given that authority by both Warren and Washington County. So we're unique in New York State in this a shared administrative office between 2 counties. The 2 counties have executed an intermunicipal agreement that details the sharing of the office and the expenses. Our administrative costs are total and split between the 2 counties through an annual chargeback mechanism to Washington County. We're carried as Warren County employees, and Warren County basically fronts the administrative costs through the year, and then with the exception of a few items like the dues to their to our statewide professional association, Washington County pays half of the administrative cost chargeback mechanism. And again, under New York State Mental Hygiene Law, Article 41 requires each local governmental unit to have a community services board. Some boards are 15 members, ours are 9 members. Both Ward and Washington counties have 9-member community services boards, separate boards. They meet jointly, but they take action separately. Members serve 4-year terms, and officers are elected for 2-year terms. How these slides are set up. We have a slide here for the Warren County Board. Mental hygiene law also specifies that the members of the board are supposed to be individuals who have an interest in the 3 disability areas covered. We try to keep a mix of professionals, parents, was also the members of our current Washington County Board. Article 41 also requires the correction and administration of an annual comprehensive planning process. We have to submit an annual plan to New York State every year that covers the three areas. This is accomplished through a subcommittee structure. So community services have subcommittees for each of the three disability areas. Plans posted on each of the county websites. So a separate subcommittee for mental health, substance abuse, developmental disabilities. We also have a children and family subcommittee that addresses various children and family issues. Subcommittees provide a venue for service system planning, coordination of services, collaboration, and general information sharing. Also involved in things like problem solving, various issues that come up in the community. We have our providers and recipients, et cetera, as part of those subcommittees to advise us on issues. Subcommittees are comprised of community service board members, staff of the office, service providers, recipients, and family members. The subcommittees all meet at least quarterly. List of our current contract agencies in Warren County. You can see for 2020 we have about $4 million contracts across various local not-for-profit agencies. List here also of the Washington County contracts, and you can see those contracts are a bit less, $4 million. Services that are contracted, whether it's contracted through Warren or through Washington, the services are for individuals of either county. So we basically have a county catchment area. Anybody residing in the 10 counties can access this is just a slide that shows web addresses for our various agencies. Most of our agencies are now developing also social media presences. Some additional responsibilities for our office with fiscal management and reporting, primarily funded with New York State aid, so it's reporting back to New York State. We have a single point of access process, the process I mentioned for individuals who have a high level of need. SPOA, or single point of access process, for adults and our children. We operate an assisted outpatient treatment program. This is also known as Pender's Law. Individuals with a certain history of non-compliance that relates to dangerousness can be taken into court and court-ordered to comply with an outpatient treatment plan. Also, certificate of need or expansion of service approvals, overall system coordination, emergency removals. We get involved if there's someone becomes a danger to themselves or others, threat of danger. They can be picked up by the police and taken to the hospital. We also have a county disaster mental health team. We have 16 volunteer clinicians from the community who've been trained in a 2-day disaster mental health curriculum. So they're basically a tool available to the Office of Emergency Services for the county. If there were to be a mass disaster, the need for a mental health component to the response, the team would be reporting, there's a component of the SAFE Act, says that certain mental health clinicians, if they are judged, if they judge an individual to be likely to engage in dangerous behavior, they have to report through the SAFE Act, and reports come to me and get forwarded on to Division of Criminal Justice Services. And then we're also just involved in various, regional healthcare planning structures. All right, put together a couple of slides just to show the comparison of the state aid versus the county tax levy. Again, we're primarily funded with state aid and also some federal aid. You can see that more than 99% of that contract funding is covered by state aid. About 38,000 of our contracts is local tax levy. There's a similar slide for Washington County, their percentage. Of the tax levy funding, the 38,000 is currently split between two of our contract agencies. The House Foundation gets most of their association. They use this funding primarily for vocational services. And that's just a similar slide. Same two Our administrative budget, top one is split primarily between the two counties. You can see Warren County is a little bit higher. Warren County does get some state aid funding that comes in that only Warren County gets, and we use that for some respite, to pay for some respite services for children and youth. And that's primarily the difference there. So it's offset by state aid revenue also. This is the split between tax levy and state and federal aid for immigration funding. Percentages there run about 77 and 23. Similar percentages. Another thing that we try to keep track of and keep the committee aware of are some forward psychiatric expenses. These can be quite variable, and in 2018 we had a particular spike in those expenses, and so we have budgeted. Sometimes we had to come back to committee and ask for increases. These are state mandated expenses versus when people are court ordered for an examination to determine if they're competent to stand trial. If they have felony charges and they're found to be not competent, then they get sent to a state hospital for restoration. And that's where these large costs come into play, because the charge back to the county for those hospitalization stays is about $500. And people can be there for, it's generally somewhere between 1 and 2 months, but it can go longer. We also pay for some family court expenses. That's the lower amount of ones. There's a similar slide for Washington County. You can see in 2018 they also had that particular slide. Their charges at 2018 were close to $200,000.
Thank you, Rob. I really appreciate it, okay? Rob's location is on Maple Street in Glens Falls. Great location. I think it's easy for people in both counties to access your office. So haven't been to one of your meetings in quite a while, but used to go to quite a few of them years ago. So just a great group of people involved with your organization.
I would just offer that if anyone would like to attend a meeting calendar meetings, so you can find us on there. Also, if anyone's interested in visiting programs or services,
I think one of the slides that kind of has always kind of caught my attention is actually it's the state aid versus the county tax levy, and we certainly get some great value in Warren County in terms of our actual financial contribution in terms of the total dollars that are indeed allocated so I think we get some great value. We thank you for that, Rob.
thank you.
Very good.
Okay, if there are no other questions, I'll go ahead and move on.
Right, yes.
Okay, just quickly, I also wanted to cover the New York State executive budget, the 2021 proposed executive budget. A couple of items I just wanted to point out, the potential impacts to the county related to our services. The governor has proposed on those 730 chargebacks to make that 100% county expense. So that would double our cost every year. That is a big impact, probably the largest impact, potential impact of what's proposed. There's also a proposed 10% reduction on some OASIS and OMH state aid for administration. We think that this, if it were to go through, would be offset by some increases that we've seen in the last few years in federal salary sharing. We also get some federal funds for administration that has increased in the last couple of years. So we think whatever these cuts are would be offset by those.
Supervisor Conor, do you have a comment?
Yeah, do you have a dollar amount attached to that, the impact to your budget as proposed?
So I don't, I can give you
Just a ballpark.
a general idea, like for our current OASIS funding and administration is $6,300, so that would be $630. Our OASIS, our office for people with developmental disabilities funding is about $12,000, so we get about $1,200 dollar amount attached to that, and our OMH funding is quite a bit more, but it's also, some of that funding is also respite funding, so I don't think that the cut would apply to that. I think it's only a portion of the OMH funding, but I don't have a dollar amount for the OMH.
Thank you, Rob.
Those are the two primary impacts that we saw related to the proposed budget.
Great, thank you, Rob. Appreciate it, and
And just quickly, I also had just program updates. We continue to work with an agency, that's Citizen Advocates Incorporated, is the agency that's planned to take over the Glens Falls Hospital behavioral health programs, their outpatient clinic programs, and that transition just continues. We anticipate now that it'll probably be somewhere in the summer this year that transition would take place.
that has been reported in the Post-Star, and so that's I would think a reasonably significant change in some of the players, I guess, that are involved. So the transition is reasonably smooth?
Yes.
Yes, good.
It's continuing. I mean, initially they had targeted an April 1 date. Now it looks like it's going to be in the summer, but things are just progressing. It's a lot of detail.
Great. Okay.
They're
Again.
Northern New York outfit. That would shock me. I mean, it seems like they're up in the middle of nowhere. Not that I want to say that's true or anything, but I was shocked that it didn't come out of a bigger city. So I'm happy that we have someone interested to take that over.
Seems to be a good organization. We also had proposed for Northern Rivers or Parsons to come in and open a new clinic. It will be just an additional clinic in the community, and those plans seem to be on hold because their application was not approved by the Office of Mental Health, citizen advocates and get them to take over the services, and then we'll see where we are in terms of level of need in the community.
Great. Thank you, Reb. Supervisor Conover?
Yeah, that 2018 spike in both counties, does that correlate to anything? It's curious that it happened in both counties in the same year.
Yeah.
Is there any correlation there?
I really don't know. I know that in a general trend, from what I hear from my statewide association, is that counties do see those costs increasing, just as a general trend. For that particular spike in 18, I don't know what that was associated with.
Well, I was curious, it's not the spike, but it spiked in both counties. Just curious.
Anything else, Rob? Good, well, thank you very much. We appreciate it.
Services.
One more?
I'll get you there.
Huh?
That was quite a spike. I mean,
Yes,
I
both
understand the
counties,
question,
that was
yeah.
security.
It seems
150,000 in Helmets in Washington, and 50-ish now it's 100,000 all in 1 year, both places.
I guess still, if you're looking at the numbers, those Queens, Hudson Falls, Fort Edmonds together, and then, our North Country and the rural part of Washington, probably different lines. Kind of similar.
I have one myself, but these guys need it. They're gonna need them here tonight.
I think you confused me.
Here, you wanna be a dance?
There you go.
Like we get the latest and greatest from her, 'cause it does. Thank you.
When we talk about the per diem spreadsheet.
Thank you. Fine, and you?
Okay.
Thank you.
Now,
Thank you so much.
I got it very abbreviated. Yeah, there we go.
That way you don't miss your smile and face.
Oh, look.
Thank you.
I was gonna say, Ryan gets a smiley face, look at that.
They got special color paper.
Yeah, special color papers.
So,
Assume coronavirus, yep. They decided to
Janelle.
make that green, huh?
Carry on.
Good morning, everybody.
Good morning.
The first resolution request is to request approval to submit an application for the 2020 Adirondack Rural Health Network Prevention Agenda Project application to receive funding not to exceed $5,000 to increase access for healthy foods. This is on attachment 6. Health Services has the opportunity to apply for funding to promote access to healthy foods. This project proposal provides an opportunity to work with Open Door Mission and Cornell Cooperative Extension to build a community garden. Individuals using the shelter will have access to fresh-grown foods and the opportunity to learn gardening skills.
Could I put a motion to put it on the floor? Supervisor Frazier, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Carried. Number.
The second is to amend a contract with Glen Falls Animal Hospital to increase the veterinarian rate to $75 per hour and the animal handler rate to $35 per hour, starting February 1st, 2020. That's on attachment 8. There has not been a rate increase in over 15 years, and actually I think my entire tenure in working with them. While staffing expenses have increased, veterinarians and animal handlers staff our clinics. Expenses are reimbursable through our clinic donations, in addition to New York State Rabies Grant and New York State aid of 36%.
Can I get a motion to put it on the floor? Supervisor McGowan, seconded by Supervisor Shepler. Any discussion? Supervisor Bramer.
This is not directly related, I don't think, but I've had some concern about what rate, if any, we are paying to the veterinarians who help us with animal cruelty. Hopefully that comes through your department at all, but it's interesting to see that we've got money coming in through donations and that we're able to pay for the rabies clinic
getting those donations, in addition to state funding, I just wonder if there's any state funding for the other side of it, you know, when we have animals who are, you know, injured or they've been neglected and abused and they need veterinarian services, medications, how are we paying for that? I know you probably don't know the answer, but I'm just throwing it out there. Maybe that's something we can start looking at.
Okay, an interesting question, I think. Maybe,
Nobody wants our animals to be suffering, right?
maybe Janelle, maybe mutually we can work on that issue and maybe report at our next monthly meeting.
Sure.
Okay, thank you.
Did we vote on that one?
We did not vote. There's a motion on the floor and a second. All those in favor?
Aye.
Opposed? Carried.
The next resolution request is to approve filling a full-time WIC assistant position. The position is vacant as of February 26th due to a resignation. The position is grade 5 and the salary is $30,520. This WIC position is needed by our department and is 100% refundable by our WIC grant.
Supervisor McGowan, second by Supervisor Conover. Any discussion? All those in favor?
Aye.
The next resolution request is to enter a $1 lease agreement with Hudson Headwaters Health Network, aka Warrensburg Health Center, to provide space for Public Health's monthly Warrensburg WIC clinic. This is attachment 14. This will make our WIC clinic more convenient to participants in addition to strengthening collaboration with Public Health and our Hudson Headwaters partners.
Motion on the floor. Is that motion by Supervisor Frazier, second by Supervisor McGowan. Any discussion? All those in favor?
Aye.
All right, this next one is to amend Resolutions 307 of 2015 and 454 of 2015 to exempt Warren County retired, retiring, and/or resigning nurses and allow the Director of Public Health and Patient Services to pay those desiring to return to health services in the per diem capacity up to the grade and step they were at retirement resignation, and just making that effective January 1st of 2020. Per diem nurses, as you know, are a very important resource to health services, assisting in our patient coverage in clinics. Currently, when a nurse retires or resigns and continues in per diem capacity, they are cut back in salary to a grade and step 5. In all cases, it's a decrease in pay rate. This will help our agency with retention of trained staff without penalizing staff by decreasing the pay rate for doing the same work. And this will exclude the weekend and holiday rates that will remain without change.
Motion made by Supervisor Conover, seconded by Supervisor Bruno. Any discussion? All those in favor?
Aye.
The next is to request resolution to amend our 2020 budget to receive Adirondack Health Institute funding, and Tawn is here. And when she gets done with that, she'll move into attachments 1 and 2.
This is for, again, we're going to put it into our health education department, which is $1,000. We've been utilizing it for many of our WIC clients. We got this additional $1,000, we'll be amending the supply line and the revenue in both our health education department.
Great. Can I get a motion to put it on the floor? Supervisor Conover, seconded by Supervisor Shepler. Any discussion? All those in favor?
Aye.
Thank you. There are no pending items at this time, and Tawn will go on to report on our expenditures.
Attachment 1 is our, as of February 16th, was our financial status at that point. Our current year, 2020, not much to show, but our 2019 is in the last column, so we'll keep that going as the books are still open. Pretty much all the expenses have been submitted, so that's all good. The revenue, our preschool program, we will be getting probably in March to April, we'll be getting our bill for the current year that we can add some more revenue to that. Noting too, again, at the salaries for looking at 2020 compared to 2019, you'll see that we're down in our overtime and our part-time salaries. We have not utilized our per diems as much this season so far, so we're down there, 3.98%, and we're at 7.72% of the budget, whereas this time last year, we were at 9.111 last year. I did want to know also that we come last month, or last in January, regarding our preschool program and the rate recons that we have built. I wanted to just give you an update. We had estimated about $670,000 in expenses. As of February 14th, the state, like I said, the state kind of tells us when we can bill. February 14th, we were able to bill for 2 of those 5 years. We billed $327,617, and we will get revenue estimated on that of about $195,000. So that's been billed. We're waiting for our current, which is 1920, like I said, with that in another year. And hopefully we'll be able to bill 2 more years within the next month or so, and then it's just 1 more year left. So hopefully all that will get into 2020 and kind of just up the rest of the revenues. We billed that and got that all done. Our attachment 2 is again our comparison last year to this year. Again, we spoke about salaries, equipment. There's nothing yet this year that we've purchased at this point. Our contractual expenses are a little bit more than last year, but when I looked into that, it's because we have already applied our rent expense for this year that we paid for our WIC program and our public health, and that was almost $120,000. So that's a lot of the difference there, is just the fact that rent expense got in a little earlier this year than it did last year. But other than that, it's status quo, and like I said, we'll keep updating you with the 2019 on this current, and you'll get an idea where we landed.
All right, next is status of referrals, which is attachment 3, Val.
Okay, when we look at assessment number 3, we have gone out as far as to the December of 2019. And if you look at the second, I guess it'd be the middle column, our referrals did better. Not much different than 2018 and 2019, the same time period, but referrals were up a little bit from the previous month, which is good. When you look down to the revisit amount, we're probably going to see more of those numbers going down. We did start for January 1st a new insurance round, which is called PDGM, and what they're looking for that is where we've always had a pattern of if you get a referral, we front-loaded our visits, so we've seen them more often in the beginning because it's known that patients tend to go back into the hospital not too far after being, discharged. In the PDGM world, insurance companies Medicare is requesting that we spread out our visits if they have therapy. So they don't want the nurse to make a visit and the physical therapist make a visit the same day. Their thoughts are that if they spread the visits out, then maybe, so you're having somebody, nurse, PT, OT, speech, somebody seeing that patient, somebody's coming more often. And then so if the therapist was out there and they identified a problem with the patient, then the nurse will go, to address that issue. So obviously our patients, their requirements of what they need home care for is bigger and bigger because their hospital stays are so much smaller. But the amount of time that the nurse is in there in a single visit, is much more to accomplish what they have to accomplish. So you're still doing the same amount of work. So that number will fluctuate. It's not that we don't have work. How insurance is to when at all possible spread them out. And with our patients, the average age is 80. It's hard for them to retain with the teaching that you're doing, or they're just too exhausted to have both services in there. So we're altering that situation. And I did meet down at the hospital, and they're figuring January, February, and part of March that the hospital census will be up because that's when you see an influx of your COPDers, the pneumonias, and the flus. And we have seen that the hospital census in some fall that we've gone out.
All right.
Thank you. Supervisor Conover.
Yeah, just back on the financials for just a moment. The spread on that revenue are you expecting quite a bit more in revenue in 19, just not yet posted to the 5.8?
The biggest one that's going to hit us is our preschool, that we will get the bill probably this month, and it's probably due in April, and we are able to bill the school year from July to December, 1920. So 6 months we'll be able to put that in. It can be anywhere from $800,000 to $1 million additional revenue that's where it is. I don't think it's going to
Sure.
work out this year, but yes, once we get that, that is something that they keep the books open, waiting for that. Again, the state will be doing that to us, we can start working on that.
Yeah. I'm just looking at the spread between 2019, even with $1 million more in revenue, and the revenue projections for 2020 are at 8.6. So,
And, right, and the other thing too is, again, which I do like to always know, is even though revenues may be down, our expenses are down. Right now, I printed, as of this morning, the current listing where we are as of 19, and right now our expenses are down, 1.3 million compared to what we budgeted. So when you look at that, and,
Right.
and the revenues are, once we add that revenue, and then that
Sure.
hopefully it'll work out, and then hopefully we'll be above the, we won't cost the county any more money.
Yeah, no, that's what, we've discussed this before,
Correct.
that was the financial plan, so to speak, going forward, so, all right, thank you.
Right.
All right, attachment 4 is our emergency preparedness sheet. It's actually 3 pages this time, so happy reading. And then we have our rabies report for attachment 5. For meeting authorizations, Jamie Martin, a part-time nutrition facilitator, will be attending a certified lactation counselor training in Schenectady from March 30th to April 3rd, which is reimbursed 100% by the State Health Department's WIC grant. Fortunately, she's on a waiting list right now, but we're hoping to get her off that. Also, 2 WIC staff to be determined will be attending the annual WIC meeting in Niagara Falls from April 9th to April 22nd. The cost of the conference is around $990, which is $495 per person, in addition to travel and lodging expenses. All expenses are also covered 100% by the WIC grant. The third is I will be attending the New York State Public Health Association Conference in Niagara Falls. That's from April 29th to May 1st, which is included in our NYSHO dues, so that's not going to show any cost because it's included. And finally, Ton, Val, and Tara Cody will be attending Home Care Association's Signature Financial Manager Summit in Troy. They'll be learning more about this PDGM that Val was talking about. On March 12th, 2020, the cost is $447, which is broken down to $149 per person. This funding is already budgeted within our CHA. Just worth noting, our rabies clinic schedule is attached. If you could maybe help your town to be aware of that, in addition to the publicity that we do. And finally, I just wanted to take a few moments to provide a coronavirus update. So if you go to your last very bright page in your packet, as you know, novel coronavirus, also known as COVID-19, is a respiratory illness with pneumonia and influenza-like symptoms, and it's spread from China since December 2019. Currently, as of today, there have been 88 cases confirmed in the United States, including our first one confirmed in New York State. Also to date, there's been 2 deaths in Washington State attributed to coronavirus. While we're seeing cases of community spread on the West Coast, the majority of cases are still remaining to be those that have been the ones that have traveled to areas of concern. We put a link there so that people can continuously monitor that if there's questions or concerns. So as far as talking points or key points, first and foremost, this is rapidly changing. Pat and I have been in pretty much every weekend on conference calls and receiving alerts and distributing that information to our partners. While most of those at risk continue to be travelers from China, the risk can also be associated travel to and from any of the geographically affected areas within the last 14 days, or people that have had prolonged exposure to a person that's tested positive. Most commonly, that's been a household relative. While the situation is a very serious public health threat, the CDC believes that the immediate risk of the U.S. public is still low at this time. Illnesses such as the flu are certainly more common and more of a concern in the United States. There are precautions that people can take, and this is where all of you can kind of help us out as far as neighbors, friends, family, and maybe concerned constituents. Social distancing is very important. That's when you keep either yourself, if you're sick, away from people, or if others are sick, staying away from them. proper hand hygiene, washing your hands more frequently than you're used to, staying home from work when sick, and isolating yourself from family members if you're sick, just so it doesn't go through the family. Respiratory etiquette. Back when we were doing pandemic influenza planning and with H1N1, there was the Do It in Your Sleeve campaign where people were encouraged to be coughing in their sleeve and then hand washing afterwards. Or if you do it in the tissue, throwing the tissue out immediately, washing your hands after that. And then I think worth noting, as with any public health emerging issue, it's critical to follow the directions provided by officials should this virus come to our area. By ensuring proper protocols are followed, everyone can do their part to help us contain the spread. At this time, CDC is not recommending for the general public to wear masks. In fact, just healthcare professionals who are actually providing to people that are persons under investigation or confirmed cases should be wearing these masks. Should an individual who meets the guidelines below, which are now on the back of the page, you basically want to be calling people ahead of time, whether it be doctor or EMS, saying, here are the symptoms that I have. Do I have any special instructions when I come in to seek medical care? Just so people can be prepared. Travelers from China, Italy, and South Korea are being screened prior to boarding flights as well as when they land in the United States. Those traveling from China and anybody that's symptomatic from those other two countries will go automatically into quarantine when they arrive at their destination in the United States. Another thing that everybody can do to stay up to date is just monitoring the CDC's website. That by far is the easiest and fastest way to be up to date. Sometimes, not that the state health department site isn't good, but they're getting their information from the CDC, so then the state's notifying their counties and they're updating their guidance. Meanwhile, the CDC has already updated theirs. State Health Department website is still vital because it's giving us New York State specific recommendations and procedures that we're all supposed to be following. So there's still a huge value with that, but if you're looking for the absolute latest information, the CDC's website's where to go. Health Services is focusing on preparedness and readiness right now. We're working with all of our community partners in multiple disciplines, schools, colleges, healthcare providers, EMS, fire, first responders. We've been working with the county attorney's office. We've been working with a judge. We've been working with all kinds of people just to ensure that our partners and resources are in place when we need them. We've also created, through Ryan Moore, a planning committee, for lack of better words, that's going to be meeting on a regular and as-needed basis to discuss any type of things that come down the pike so that we're able to be on top of that. And on the back it has our current criteria that was changed over the weekend.
This was
It was
changed
either
Thursday. It was
Thursday or
changed
over
Thursday.
the weekend. I think the CDC alert came out Thursday and the state alert came out on Saturday. But you to follow up to update their guidance with that. So, if there's any
Okay,
quick
did
questions.
you have something, Supervisor Conover? Did I see your hand up earlier, or?
Oh, no.
Okay.
I was just wondering on the travel, did you need a motion on the travel? It says meeting authorizations.
No, no.
Okay, thank you.
Good.
One other quick thing that I'll provide as an update, and I'm sorry I don't have the numbers directly with me. I printed them out and forgot to bring it. But we get around $52,000 for our emergency preparedness grant. That's predominantly covering staffing and fringe benefits from that scenario and some supplies and a few other miscellaneous expenses. But when you saw that the governor was appropriating the $40 million, that we received notification that we received an additional $24,000, I think it was, and some change, to be able to support our efforts here. So that will certainly take care of any of the new expenses that might come on when we're responding to this when it starts to hit our area. So just thought that's good news. And the other good news is I don't have to come with a resolution request because they had built in emergency funding in our grant when it was approved initially. So we're able to kind of quickly accept this money without it being a concern. And they've really kind of lowered the threshold for spending to cover expenses, just knowing that they might be unique and we're not quite sure what we might need. So the state has been very good about that.
Thank you. Any more comments? Supervisor McGowan?
You said when. So you really think it's gonna end up here, eh?
We want to be prepared.
I don't blame you.
And as a good Girl Scout, hopefully our efforts won't be needed.
Being a Boy Scout, I understand, yes.
Any further discussion from anyone on the committee? Anyone in the room? Any further discussion?
Wife already.
Seeing none, Supervisor Connors. Good, thank you. Can I get a motion to adjourn, please? Supervisor Bruno, seconded by Supervisor Shepley. All those in favor?
Aye.
Thank you.
Oi.
Good luck.